St. Luke's University Health Network in your community. Today, we visit St. Luke's Primary Care Facility in Brodheadsville. Primary care refers to both family medicine and internal medicine. Family medicine cares for patients of all ages, from infants to the elderly. Family medicine often cares for the same patients throughout their lives. Internal medicine doctors care primarily for adults. They specialize in diagnosis, treatment, and prevention of disease in their adult patients. They're trained to offer care for a wide variety of health conditions and to counsel their patients on prevention and overall wellness.
Doctor that you call when you're sick or have a cold or sore throat, but also we take care of diabetes and all types of chronic diseases as well.
I see kids, I see grandmas, I see aunts and uncles, and I see the whole family. And yes, it's comprehensive family care because I see them from the time that they're born all the way until they're a senior.
When you're happy and you're healthy, we want to keep you that way. And some of the best ways for us to do that are make sure we're checking in, usually on an annual basis if you don't have chronic medical conditions, instead of waiting for a problem to arise and then trying to scramble and fix from there.
If we can catch diseases before they start, then we can treat them and take care of them.
So how do you go about finding the right primary care doctor for you?
A lot of my patients go online, they look me up and they want to know, what does my doctor look like? What focus does she have when it comes to health and getting me better?
I think it's really important to feel that you have a good connection with your doctor. If you don't feel comfortable talking to your doctor, you're not going to be able to bring up things that may be sensitive or uncomfortable. So if you're a female and you prefer to see a female provider because you feel more comfortable, then advocate for that and make sure you're seeing a female, or vice versa. If you're a female and prefer to see a male provider, then make sure that you're seeking out care through a male provider.
A lot of times it's just meeting the doctor and having your first visit and seeing if you connect. Everybody has their own style and their own needs and preferences. So I think maybe just setting up a visit and coming in and meeting us and seeing if it's the right fit for you.
It's okay to switch doctors. You don't need to be locked into a relationship with a provider for the next 20 years if you don't feel comfortable with them.
Primary care providers want to know you, your medical history, and your wellness goals.
Yeah, I think St. Luke's has a real culture of caring. We take care of our patients as individuals. So we see everybody as an individual. We are not just a number or, someone who's coming through and we have no connection with you, but we really truly do try to build a connection with our patients and develop that relationship.
I think that's what makes my job amazing, just having those connections with my patients and their families and just looking forward to really seeing them and them looking forward to seeing me, of course. It's always great.
Doctors say an educated patient is an informed patient.
Education is huge, and I spend a lot of time with my patients just breaking down really on a smaller level what is happening in their body, why this is happening, how the medication works, what is it doing in your body, and why you should take it.
If you have diabetes and I tell you got to eat less sugar, and you think, okay, great, I'll eat less sugar, so you stop eating ice cream. Well, if I haven't done a really good job in explaining where sugar comes from and carbohydrates and how all of that plays into diabetes, you might stop eating ice cream, but it's not going to change what we need it to change in terms of making progress in controlling the diabetes.
Patients come to me with a concern, and we work together to come up with a diagnosis and a treatment plan.
When you work with a St. Luke's primary care provider, you have access to specialists and other resources to help you.
We are fortunate to be part of a large network, so we have a lot of resources available to us, so we can help patients who come to see us in primary care get connected with the appropriate specialists or, getting in for testing and things like that.
On any given day, if I have a patient that needs to see an endocrinologist and we don't have anyone within a 10-15 mile radius, my staff are getting on the phone calling someone in Allentown or Bethlehem who can see the patient as soon as possible.
Remember, St. Luke's family doctors are committed to personalized health care with compassion.
When we talk about having a family doctor, you have someone that you see regularly or routinely, and they're your anchor within the medical community. So what that means is, if you have a question about why you're not feeling well today, if you have a question about medication that you're starting, if you have a question about your mom having breast cancer, what is your risk of having breast cancer? Having a family doctor is like having your anchor in the medical community. Who can I go to when I have questions about my health or my risk of developing health complications?
Healthcare is very complicated. So when you start seeing a lot of different doctors, your primary care doctor really will advocate for you, kind of oversee all the different aspects of your health.
We have a very patient-centered focus on our care that we provide here. And I think that the familial atmosphere, even within the offices, that is promoted is really nice. It's warm, it's inviting. And I think that's relatively unique in larger healthcare systems.
I live here and I work in the community where I live, so I'm really invested in my patients, and I treat everybody just like a family member, and I've gotten to know so many great patients over the years.
For more information on primary care and family medicine, go to slhn.org.